Hi friends, I'm Dr. Jeevan Joseph, consultant endocrinologist and director of Vimala Hospital, Etumanur, Kottayam, and Jeevan's Diabetes and Endocrine Center. Today, we are going to have a short discussion on a topic that is probably not very commonly addressed in our consultations when patients come to us to see us with diabetes and various other hormonal problems. One of the big things that men find difficult to discuss is erectile dysfunction, or the inability to sustain or maintain an erection to have a successful sexual intercourse. This is difficult for men to discuss in an open environment, especially in a clinic where many other people might be standing or relatives may be present, and so on and so forth. So that's why we are going to, in this video, discuss a little bit about erectile dysfunction, its causes, and what might be the new solutions to deal with this problem. So erectile dysfunction can happen because of a number of things. Either there is some damage to the nerves because the patient has undergone some surgery, maybe a surgery for the prostate, etc., or the patient has hormonal problems like a low testosterone level, or sometimes the patient has uncontrolled diabetes. Sometimes it's got nothing to do with any of this and it's just a psychological issue. At one point it was thought that erectile dysfunction is predominantly a big psychological problem, but now we know that it's much more of a mixed problem where there are many causes to this issue. So we now look at what treatments are available for erectile dysfunction. Generally, the first treatment that we tend to give is tablets like phosphodiesterase inhibitors. You might have heard of these, sildenafil, Viagra, tadalafil, and things of tablets of that nature. They basically increase the blood flow and sustain an erection. But many men find this that it's not working to the level that they would like or wish, and they find it unsatisfactory. And previously we've not had good treatments after this because the other things have been either injections like alprostadil to the base of the penis, which can be a bit uncomfortable, or vacuum pumps or surgical implants, which are all reasonably difficult to do and not very popular. Now we have a new treatment called the Tesla former chair. This is what you're seeing here. We are one of the centers that has it in South India, and what this does is gives focused functional magnetic stimulation. So there are magnets on every side. As you sit, you don't have to remove your dress to have the treatment. It's a 30-minute session. You sit on the chair fully clothed, and it delivers focused magnetic stimulation to the muscles of the pelvic area, and also gives stimulation to the nerves of that area, like the cavernous nerve, the pudendal nerve, the ischiocavernosus muscle, and the bulbocavernosus muscle, and so on. So by delivering these focused magnetic stimulation and bringing about supramaximal contractions of these muscles and stimulation of these nerves, which increases the blood flow, it strengthens the pelvic muscles of that area, and also the nerves that actually control and help with erection. So generally, if a person goes through around 6 sessions, each session being around 30 minutes every alternate day, so that's the kind of sequence and the time that you need. This gives you a non-surgical, conservative, but at the same time an effective way to treat erectile dysfunction if tablets are not doing the trick. And this is a new kind of therapy. We all know how magnets work. We all have heard of MRI scans and the application of magnets in medicine. So application of magnetic stimulation, magnetic therapy itself is not new, but functional magnetic stimulation to use this to actually treat erectile dysfunction is one of the newer modalities of the Tesla former chair. The chair can also be used for low backache, treating problems like that, and also in women for treating incontinence, and so on and so forth. So this is one of the new treatments that perhaps might be useful if this is a problem that you are grappling with and you are wondering how we can have a solution to it. Thank you.